So I'm going to be providing some client education on COPD. So COPD stands for chronic obstructive pulmonary disease. It basically just means that the tissues in your lungs are kind of always getting irritated and inflamed, and they're losing their elasticity. So it can be harder to inhale and exhale. It can be preventable, but it's very manageable. 16 million adults in the United States actually have COPD. Um, because it's chronic, it just means it's going to last a long time. So you're going to be experiencing some of these symptoms. But an exacerbation is when you suddenly have a worsening of these symptoms, and it's normally acute, so it's not going to last that long. Exacerbations are most commonly caused by an infection. So you might have sputum when you cough, you might feel like you can't catch your breath or you can't get a deep breath, or you could just have a dry, annoying cough. The best way to avoid an exacerbation is just washing your hands, using an incentive spirometer, and cutting down or stopping smoking. Some diagnostic tests for COPD is going to be the FEV-FCV or FVC ratio. It's kind of the only way to diagnose COPD, and it just measures how much your lungs can hold, how much they can blow off, that kind of thing. You're probably going to have a lot of chest x-rays if you have an exacerbation. It doesn't really help with diagnosing COPD. It's just going to show how your COPD is affecting your lung and heart tissues. ABGs are also normally monitored during an exacerbation stay. It's just a blood test. It's going to tell us the pH and how much oxygen, carbon dioxide, or bicarbonate is left over in your lungs. And a physical or respiratory therapist might do a 6-minute walk test with you. They put not an incentive spirometer, they put a pulse ox on your finger. It's almost the same as putting a clothespin on your finger. You walk around for 6 minutes. And it's just going to measure how much oxygen you're actually getting if you're breathing effectively. So some modifiable risk factors I want to discuss are just preventing infection. So washing your hands, it's really simple. 20 seconds with warm water before you eat, after you use facilities. You also really want to focus on deep breathing and coughing. So there is a huff cough method. You're going to want to sit up straight, relax your shoulders. You're going to breathe in until you can almost feel it in your stomach, really big breath. Hold it for a couple of seconds, and then as forcibly as you can, blow it out like you're fogging up a mirror. You can repeat this 2 times. You're going to want to try as much as you can not to cough while you huff the air out. And then once you can feel the secretions up a little bit higher, that's when you're going to want to cough. And you could do this up to 5 times, or if you just get too tired or lightheaded. Another breathing technique that's going to be really important is the incentive spirometer. You're going to want to inhale slowly. You're going to see a ball rise in between 2 prongs is where you're going to want to keep it. It's called the good range. You can do this as many times as you want during the day, but we definitely want you to do it at least 10 times every waking hour. So if you're watching TV, just go ahead and do it every time you see a commercial. It's really effective in preventing pneumonia and other respiratory infections that are going to worsen your COPD. And smoking is going to be a huge risk factor for any respiratory disease. And it also makes you more susceptible to other diseases like coronary artery disease, high blood pressure, and even stroke. It can almost feel impossible to quit smoking if you have been for a while. So there is a lot of resources that I can connect you with to cut down on smoking and hopefully stop completely, there is a medication called varenicline. Its brand name is Chantix. It is a really helpful aid in smoking cessation, and I think that with some counseling and follow-up stays that it can be really beneficial, so I'm going to talk to your provider about that. And then some diet modifications with COPD. Sometimes it can just be too hard to eat. It's really hard to catch your breath. So weight loss is a really good predictor of a really bad prognosis, and it will actually increase the amount of times that you'll have exacerbations. So it's important to increase protein. So you're going to want to have 1.5 to 2.5 grams of protein for every kilogram of body weight. There is 1 kilogram for every 2.2 pounds. So I would recommend keeping a food journal and just writing down how many calories you're eating every day and how many grams of protein you eat every day. And I can show you how to locate that information on the nutrition facts.